Question 1. A client reports frequently feeling overwhelmed, having difficulty sleeping, and experiencing persistent worry about potential relapse, despite maintaining sobriety for 6 months. Which of the following co-occurring conditions should the counselor primarily consider assessing for? A. Bipolar disorder. B. Schizophrenia. C. Generalized anxiety disorder. D. Borderline personality disorder. Answer: C. Generalized anxiety disorder. The concept being tested here is the identification of common co-occurring mental health conditions alongside substance use disorders. The keywords overwhelmed, difficulty sleeping, persistent worry, and potential relapse are strong indicators of anxiety. Generalized anxiety disorder, GAD, is characterized by excessive, uncontrollable worry about various aspects of life, often including health and future events like relapse, accompanied by physical symptoms such as sleep disturbance. While other disorders might present with some of these symptoms, GAD most accurately fits this constellation of symptoms. For example, a client constantly worrying about relapse and struggling to sleep due to racing thoughts perfectly illustrates GAD. When a client expresses ongoing, pervasive worry that impacts their daily life and sleep, always consider screening for anxiety disorders as a primary step. Question 2. During the initial screening process, a client reveals they have previously received substance use treatment at another facility. What is the counselor's primary ethical responsibility regarding this information? A. To immediately contact the previous treatment facility for records. B. To document the information and obtain a release of information from the client to request records. C. To disregard the information unless the client brings up their past treatment again. D. To advise the client that previous treatment information is not relevant to their current situation. Answer: B. To document the information and obtain a release of information from the client to request records. This question tests the ethical and professional responsibilities related to client confidentiality and information gathering. The crucial ethical principle here is client consent. While past treatment information is highly relevant for effective care, a counselor must never contact a previous facility or share information without the client's explicit, written permission, known as a release of information, ROI. For example, if a client mentions previous treatment, the counselor should say, "That's helpful to know. If you'd like us to get those records, we'll need you to sign a release form." Always remember that client confidentiality and autonomy are paramount. Always obtain proper consent before sharing or requesting any client information. Question 3. A client in early recovery is struggling with cravings and reports feeling easily triggered by environmental cues. Which counseling approach would be most effective in teaching the client to identify and change these thought patterns and behavioral responses? A. Psychodynamic therapy. B. Client-centered therapy. C. Cognitive behavioral therapy, CBT. D. Gestalt therapy. Answer: C. Cognitive behavioral therapy, CBT. This question focuses on the application of different counseling theories, specifically for relapse prevention and managing triggers. The keywords struggling with cravings, easily triggered by environmental cues, and identify and change these thought patterns and behavioral responses are direct indicators for cognitive behavioral therapy, CBT. CBT is highly effective in addiction treatment because it helps clients recognize the thoughts, feelings, and situations, triggers, that lead to substance use and teaches them new coping skills and alternative behaviors. For instance, a CBT approach might involve a client identifying the thought, "I can't cope without a drink," and learning to challenge it with, "I have coping skills, and I can manage this feeling." Remember, when the goal is to directly modify thoughts and behaviors related to substance use, CBT is often the go-to strategy. Question 4. What is the primary purpose of conducting a comprehensive psychosocial assessment for a client entering substance use treatment? A. To determine the client's eligibility for financial assistance programs. B. To gather information about the client's strengths, needs, and overall life circumstances to develop an individualized treatment plan. C. To diagnose all potential co-occurring mental health disorders immediately. D. To fulfill administrative requirements for billing and insurance claims. Answer: B. To gather information about the client's strengths, needs, and overall life circumstances to develop an individualized treatment plan. This question assesses understanding of the core purpose of a psychosocial assessment in addiction counseling. The keyword primary purpose directs attention to the central goal, which is far beyond just administrative tasks or immediate diagnoses. A comprehensive psychosocial assessment gathers a broad range of information, including substance use history, mental health, family background, social support, employment, education, and legal issues, to understand the client holistically. This complete picture is essential for developing a tailored, effective treatment plan that addresses all relevant areas of the client's life. For example, discovering a client has strong family support can be a significant strength to integrate into their recovery plan. Remember, the assessment is the foundation for creating a treatment plan that truly fits the individual. Question 5. A client in group therapy consistently monopolizes discussions, interrupts others, and offers unsolicited advice, causing other members to become disengaged. How should the group facilitator primarily address this behavior? A. Allow the client to continue, as it shows engagement with the group process. B. Gently redirect the client, reinforce group rules, and encourage participation from other members. C. Ask the client to leave the group for that session. D. Ignore the behavior, hoping it will resolve on its own. Answer: B. Gently redirect the client, reinforce group rules, and encourage participation from other members. This question tests effective group facilitation skills and addressing disruptive behaviors. The keywords monopolizes discussions, interrupts others, and causing other members to become disengaged highlight a need for intervention. A group facilitator's primary role is to maintain a safe and productive environment for all members. This requires direct but gentle intervention, reminding the client of group norms, like respectful listening, and creating space for others to speak, rather than allowing the behavior to persist or taking punitive action immediately. For example, the facilitator might say, "Thank you for your input, let's ensure everyone has a chance to share." Sarah, what are your thoughts? Remember, balancing individual expression with group dynamics is key to effective group leadership. Question 6. A counselor is working with a client who identifies as an atheist and expresses discomfort with the spiritual components often found in 12-step programs. What is the most appropriate and culturally sensitive response from the counselor? A. Emphasize that the 12 steps are the only proven path to recovery and encourage them to reconsider. B. Explain that God or higher power can be interpreted individually, and explore other recovery pathways or secular options. C. Suggest that the client needs to find a spiritual belief to recover effectively. D. Refer the client to a different counselor who specializes in spiritual counseling. Answer: B. Explain that God or higher power can be interpreted individually, and explore other recovery pathways or secular options. This question addresses cultural competence and flexibility in recovery approaches, especially regarding spirituality and diverse beliefs. The keywords atheist, discomfort with spiritual components, and most appropriate and culturally sensitive response are critical. Effective counseling recognizes that recovery pathways are diverse and not one-size-fits-all. The counselor should validate the client's perspective, explain the flexible interpretation of higher power in 12-step programs, e.g., as the group itself or a universal force, and be prepared to explore or refer to alternative, secular recovery options, like smart recovery or medication-assisted treatment, that align with the client's values. For instance, explaining that some individuals view the higher power as the collective strength of the group can be very helpful. Always respect a client's individual beliefs and help them find a recovery path that resonates with them. Question 7. Which of the following best describes the concept of therapeutic alliance in addiction counseling? A. The formal agreement signed by the client and counselor outlining treatment goals. B. The working relationship and bond of trust, respect, and collaboration between the client and counselor. C. The process of involving family members in the client's recovery journey. D. The legal and ethical obligations of the counselor to protect client confidentiality. Answer: B. The working relationship and bond of trust, respect, and collaboration between the client and counselor. This question tests understanding of a fundamental concept in effective counseling, the therapeutic alliance. The concept refers to the quality of the collaborative relationship. The keywords therapeutic alliance point directly to the connection between the client and counselor. A strong therapeutic alliance is characterized by mutual trust, respect, empathy, and agreement on treatment goals, which significantly predicts positive treatment outcomes, regardless of the specific therapeutic approach used. For example, if a client feels genuinely heard and understood by their counselor, they are more likely to be open, engaged, and committed to treatment. Always remember that building a strong, trusting relationship is the bedrock upon which all other counseling interventions are built. Question 8. A counselor is preparing to discharge a client from an intensive outpatient program. What is the most crucial element to include in the discharge planning to support long-term recovery? A. A detailed list of all treatment activities completed during the program. B. A comprehensive aftercare plan, including relapse prevention strategies, support systems, and follow-up resources. C. A final summary of the client's attendance and participation rates. D. A recommendation for the client to avoid all previous friends and social settings. Answer: B. A comprehensive aftercare plan, including relapse prevention strategies, support systems, and follow-up resources. This question focuses on the essential components of discharge planning, emphasizing long-term recovery. The keywords most crucial element and long-term recovery highlight the importance of proactive planning for post-treatment success. Simply reviewing past activities or recommending isolation is insufficient. An effective discharge plan anticipates challenges, identifies potential triggers, outlines specific relapse prevention strategies, lists ongoing support systems, e.g., 12-step meetings, sober living, individual therapy, and provides contact information for crisis and follow-up resources. For example, the plan might include specific people to call during a craving or a schedule of recovery meetings to attend. Always ensure the client leaves treatment with a clear, actionable roadmap for maintaining sobriety. Question 9. Which of the following is an example of a harm reduction strategy in substance use treatment? A. Requiring complete abstinence from all substances as the only treatment goal. B. Providing clean needles to intravenous drug users to prevent the spread of infectious diseases. C. Imposing strict legal penalties for drug possession and use. D. Focusing solely on spiritual awakening as the path to recovery. Answer: B. Providing clean needles to intravenous drug users to prevent the spread of infectious diseases. This question tests understanding of the harm reduction philosophy in addiction treatment. The concept of harm reduction focuses on minimizing the negative consequences associated with substance use rather than exclusively demanding abstinence. The example of providing clean needles is a classic harm reduction strategy aimed at preventing the transmission of HIV, hepatitis C, and other bloodborne diseases, even if the person continues to use drugs. This approach acknowledges that not all individuals are ready or able to achieve abstinence immediately and seeks to keep them safer in the meantime. For instance, also providing fentanyl test strips to prevent overdose falls under harm reduction. Remember, harm reduction is about meeting people where they are and reducing health and social risks associated with drug use. Question 10. A client reports experiencing intense cravings, nausea, muscle aches, and irritability approximately 12 hours after their last dose of heroin. These symptoms are characteristic of what stage of substance withdrawal? A. Post-acute withdrawal syndrome, pause. B. Acute withdrawal. C. Psychological dependence. D. Tolerance development. Answer B. Acute withdrawal. This question is about identifying the symptoms and timing associated with acute substance withdrawal, a critical concept in understanding the physiological effects of addiction. The keywords intense cravings, nausea, muscle aches, and irritability, appearing 12 hours after their last dose of heroin, are classic signs of acute opioid withdrawal. Acute withdrawal refers to the initial, severe physical and psychological symptoms that occur when a person stops or significantly reduces their substance use, typically requiring medical management. Post-acute withdrawal syndrome, pause, symptoms are more subtle and prolonged, occurring weeks or months later. For example, a person going through acute alcohol withdrawal might experience tremors and seizures within 24 to 48 hours. Always recognize that these immediate, severe physical symptoms signal acute withdrawal, which often necessitates medical supervision. Question 11. What is the primary ethical principle violated when a counselor shares confidential client information with an unauthorized third party without the client's explicit consent? A. Beneficence. B. Non-maleficence. C. Fidelity. D. Confidentiality. Answer D. Confidentiality. This question directly assesses knowledge of core ethical principles in counseling. The keywords shares confidential client information, unauthorized third party, and without the client's explicit consent clearly indicate a breach of confidentiality. Confidentiality is the ethical duty of counselors to protect client information and prevent its disclosure without proper authorization, forming the bedrock of trust in the therapeutic relationship. While sharing information might also indirectly violate beneficence, doing good, or non-maleficence, doing no harm, by eroding trust, confidentiality is the direct principle violated. For example, discussing a client's treatment details with a mutual acquaintance is a direct violation of this principle. Always remember that maintaining confidentiality is a fundamental ethical obligation in all counseling practice. Question 12. A counselor observes a client exhibiting increased agitation, paranoia, and grandiosity after reportedly discontinuing their prescribed antipsychotic medication. What is the most appropriate initial action for the counselor to take? A. Immediately terminate counseling services due to non-compliance. B. Confront the client about their non-adherence and demand they restart medication. C. Document observations, discuss concerns with the client, and consult with or refer to a psychiatrist or medical doctor. D. Focus solely on behavioral interventions to manage the client's agitation. Answer C. Document observations, discuss concerns with the client, and consult with or refer to a psychiatrist or medical doctor. This question assesses the appropriate response to clients with co-occurring disorders who may be experiencing medication-related issues. The keywords increased agitation, paranoia, and grandiosity and discontinuing their prescribed antipsychotic medication strongly suggest a destabilization of mental health. A counselor's primary role is to ensure client safety and well-being. This involves documenting changes, openly discussing concerns with the client, and most importantly, consulting with or referring to a medical professional, like a psychiatrist, who can assess the medication issue and adjust treatment. For instance, a counselor might say, "I've noticed some changes, and I'm concerned. It sounds like a good idea for us to talk with your doctor about your medication." Always remember that medication management falls outside the scope of practice for most addiction counselors, so prompt consultation or referral to a medical professional is crucial. Question 13. Which of the following is a key principle of motivational interviewing, MI? A. Confrontation and direct persuasion to change. B. Expressing empathy and supporting client autonomy. C. Focusing primarily on past traumas as the root of addiction. D. Providing immediate solutions and advice to clients. Answer: B. Expressing empathy and supporting client autonomy. This question tests knowledge of the core principles of motivational interviewing, MI, a widely used counseling approach in addiction. The concept of MI is that it is a collaborative, goal-oriented style of communication with particular attention to the language of change. The keywords "key principle of motivational interviewing," MI, should immediately bring to mind its non-confrontational, client-centered nature. MI emphasizes expressing empathy, understanding the client's perspective, developing discrepancy, helping clients see the gap between their current behavior and their values, rolling with resistance, and supporting self-efficacy, believing in their ability to change, all while respecting the client's autonomy to make their own choices. For example, instead of telling a client they need to quit, an MI approach would explore their own reasons for wanting to change. Always remember that MI is about guiding and evoking change from within the client, not imposing it. Question 14. A client expresses frustration with their progress, stating, "I've tried before, and I always relapse. What's the point?" The counselor recognizes this as a sign of low self-efficacy. What is the most effective way for the counselor to respond using principles of self-efficacy enhancement? A. Remind the client of past failures to underscore the difficulty of recovery. B. Validate their feelings and collaboratively identify small, achievable goals they have successfully met or can meet. C. Tell the client that recovery is a choice and they just need to try harder. D. Share a personal story of overcoming a similar challenge. Answer: B. Validate their feelings and collaboratively identify small, achievable goals they have successfully met or can meet. This question focuses on the concept of self-efficacy, which is a person's belief in their ability to succeed in specific situations or accomplish tasks, and how to enhance it in counseling. The keywords frustration with their progress, always relapse, and low self-efficacy clearly indicate the need to build the client's confidence. The most effective way to enhance self-efficacy is by helping clients experience success, even small ones, and recognize their own capabilities. Validating their feelings shows empathy, and then collaboratively setting and achieving small, manageable goals provides tangible evidence of their ability to change, countering the feeling of hopelessness. For example, celebrating a client's ability to attend all their meetings for a week can build confidence for the next week. Always remember to break down big goals into smaller, achievable steps to build a client's belief in their own power to change. Question 15. What is the primary goal of psychoeducation in addiction treatment? A. To diagnose co-occurring mental health disorders. B. To teach clients and their families about addiction, its effects, and the recovery process. C. To provide intensive individual therapy sessions. D. To enforce abstinence through confrontational techniques. Answer B. To teach clients and their families about addiction, its effects, and the recovery process. This question assesses the understanding of psychoeducation's role in addiction treatment. The concept of psychoeducation is about providing information and education. The keyword primary goal focuses on the main purpose. Psychoeducation aims to empower clients and their families by giving them knowledge about the disease of addiction, its impact on the brain and body, common triggers, coping mechanisms, and the various stages and challenges of recovery. This understanding helps reduce stigma, increases motivation for treatment, and equips individuals with tools to manage their condition. For example, explaining how certain substances affect brain chemistry can help a client understand their cravings. Always remember that knowledge is empowering in recovery. Psychoeducation helps demystify addiction and the recovery journey. Question 16. A client in recovery expresses strong feelings of guilt and shame regarding past behaviors while actively using substances. What is the most appropriate therapeutic approach to help the client process these emotions? A. Encourage the client to suppress these feelings and focus only on the future. B. Validate their feelings, explore the impact of their past actions, and guide them towards self-compassion and making amends where appropriate. C. Tell the client that everyone in recovery feels this way, so it's normal and they should move on. D. Reassure them that their past actions weren't that bad in the context of their addiction. Answer B. Validate their feelings, explore the impact of their past actions, and guide them towards self-compassion and making amends where appropriate. This question focuses on addressing complex emotions like guilt and shame, which are common in recovery. Simply suppressing or dismissing these feelings is unhelpful and can hinder healing. The most appropriate approach involves validating the client's emotional experience. It's understandable you feel that way, creating a safe space to process the impact of their past behaviors, and gently guiding them towards self-compassion. This also includes exploring the possibility of making amends, which can be a crucial step in healing and reducing guilt. For instance, helping a client understand that their actions were a symptom of their disease, while still acknowledging the hurt caused, can foster self-forgiveness. Remember, processing difficult emotions constructively is vital for lasting recovery, not ignoring them. Question 17. Which of the following best describes the purpose of a safety plan in the context of crisis intervention for a client with co-occurring substance use and suicidal ideation? A. A legal document outlining the counselor's responsibilities. B. A detailed contract for the client to achieve abstinence. C. A written plan developed with the client that outlines steps to take when suicidal thoughts intensify. D. A record of all previous crisis interventions for the client. Answer C. A written plan developed with the client that outlines steps to take when suicidal thoughts intensify. This question addresses the critical role of a safety plan, especially when dealing with the high-risk scenario of co-occurring substance use and suicidal ideation. The keywords safety plan, crisis intervention, and suicidal ideation point directly to a specific, collaborative, and preventative tool. A safety plan is a personalized, written document created with the client that identifies triggers, lists coping strategies, identifies support persons, and outlines steps to take, e.g., calling a helpline or going to an emergency room, when suicidal thoughts become overwhelming, thereby reducing immediate risk. For example, the plan might list 3 trusted friends to call or a specific grounding exercise to use. Always prioritize client safety by creating a clear, actionable safety plan with clients at risk. Question 18. A client consistently misses scheduled appointments and reports difficulty remembering their commitments. The counselor suspects potential cognitive impairment. What is the most appropriate initial action? A. Terminate services due to lack of client engagement. B. Refer the client for immediate neurological testing. C. Explore potential barriers to attendance, offer reminders, and consider accommodations while documenting observations. D. Assume the client is resistant to treatment and confront their non-compliance. Answer: C. Explore potential barriers to attendance, offer reminders, and consider accommodations while documenting observations. This question focuses on how to respond to potential cognitive challenges in clients, especially those that might be linked to substance use. The keywords consistently misses appointments, difficulty remembering commitments, and suspects potential cognitive impairment indicate a need for a supportive and investigative approach. The initial action is not to jump to termination or immediate medical referral but to first try to understand the barriers from the client's perspective, offer practical support like appointment reminders, and make reasonable accommodations. This also involves thorough documentation of observations, which could inform future referrals if cognitive issues persist. For instance, the counselor might ask, "What makes it hard for you to remember our appointments?" Remember, patience and practical support are key when addressing potential cognitive challenges. Question 19. When working with a client from a collectivistic culture, which approach to family involvement is generally most respectful and effective? A. Encourage the client to prioritize individual recovery goals, separate from family influence. B. Involve the extended family in treatment planning and recovery support, with the client's consent. C. Limit family involvement to immediate household members only. D. Advise the client that family involvement is typically counterproductive to recovery. Answer: B. Involve the extended family in treatment planning and recovery support, with the client's consent. This question addresses cultural competence, specifically concerning family involvement in treatment. The keyword collectivistic culture is crucial. In collectivistic cultures, the family unit, often including extended family, plays a central role in an individual's life and decision-making. Therefore, involving the extended family in treatment planning and recovery support, with the client's consent, is often the most respectful and effective approach, as it aligns with their cultural values and leverages their natural support system. For example, a client from a collectivistic culture might feel more supported and accountable if their elders are aware of and involved in their recovery journey. Always adapt your approach to respect and integrate the client's cultural context, especially regarding family. Question 20. Which medication is commonly used to help manage alcohol cravings and reduce heavy drinking by blocking opioid receptors in the brain? A. Disulfiram, antabuse. B. Naltrexone, Vivitrol, Revia. C. Acamprosate, Camprol. D. Bupropion, Wellbutrin. Answer: B. Naltrexone, Vivitrol, Revia. This question tests knowledge of common pharmacotherapies used in addiction treatment, specifically for alcohol use disorder. The keywords alcohol cravings, reduce heavy drinking, and blocking opioid receptors are direct indicators for naltrexone. Naltrexone works by blocking the opioid receptors, which reduces the pleasurable effects of alcohol and diminishes cravings, making it easier for individuals to reduce or abstain from drinking. Disulfiram works by creating an unpleasant physical reaction to alcohol, and acamprosate helps restore chemical balance in the brain post-abstinence. For example, a client taking naltrexone might find that if they do take a drink, it doesn't provide the same buzz, making it easier to stop. Always understand the mechanism of action for common MAT medications to best educate clients. Question 21. A counselor is conducting a group therapy session. A new member expresses feelings of intense discomfort and vulnerability, stating they are unsure if they can share openly with strangers. What stage of group development is this typically indicative of? A. Norming. B. Performing. C. Forming. D. Adjourning. Answer: C. Forming. This question tests knowledge of the stages of group development. The keywords new member, intense discomfort and vulnerability, and unsure if they can share openly with strangers are classic signs of the forming stage. The forming stage is the initial phase where group members are often tentative, anxious, and testing the waters. They are getting to know each other, establishing trust, and figuring out the group's purpose and norms. Later stages like storming involve conflict, norming involves cohesion, and performing involves working effectively. For example, in the forming stage, members might speak generally about their problems rather than sharing deep personal struggles. Always remember that initial discomfort is normal. The facilitator's role is to foster safety and trust in this early stage. Question 22. Which of the following is considered a core component of effective relapse prevention planning? A. Focusing solely on avoiding all triggers. B. Developing coping skills to manage cravings and high-risk situations. C. Relying exclusively on willpower to maintain sobriety. D. Disconnecting from all past social networks and supports. Answer: B. Developing coping skills to manage cravings and high-risk situations. This question focuses on the essential elements of relapse prevention. The concept of relapse prevention involves preparing clients for challenges they will face in recovery. The keywords core component and effective relapse prevention planning point to strategies that empower the client. While avoiding some triggers can be helpful, it's often unrealistic to avoid all of them. Effective relapse prevention focuses on equipping clients with concrete coping skills, e.g., mindfulness, distraction, calling a sponsor, to actively manage cravings and navigate high-risk situations when they inevitably arise, rather than solely relying on willpower or complete isolation. For example, a client might learn to use a specific relaxation technique when feeling overwhelmed rather than immediately reaching for their substance of choice. Always remember that equipping clients with a toolbox of coping skills is crucial for navigating the unpredictable journey of recovery. Question 23. A counselor suspects that a client may be at risk for domestic violence, based on subtle cues and reported arguments with their partner. What is the counselor's primary ethical and professional responsibility in this situation? A. To immediately report the partner to law enforcement. B. To directly confront the partner during a joint session. C. To assess the client's safety, provide information on resources, and discuss a safety plan if appropriate, while maintaining client confidentiality. D. To ignore the cues unless the client explicitly states they are being abused. Answer: C. To assess the client's safety, provide information on resources, and discuss a safety plan if appropriate, while maintaining client confidentiality. This question addresses the ethical and professional response to suspected domestic violence. The keywords suspects that a client may be at risk, subtle cues, and primary ethical and professional responsibility highlight the need for careful, client-centered intervention. The counselor's priority is the client's safety. This involves discreetly assessing the level of risk, providing information about domestic violence resources, e.g., hotlines, shelters, and collaboratively developing a safety plan, all while respecting client confidentiality unless there's a duty to warn or report, which varies by jurisdiction and specific threat. For example, a counselor might ask, "Are you safe at home? Are there times you feel afraid?" Always prioritize assessing safety and empowering the client with resources, without jumping to conclusions or breaking confidentiality prematurely. Question 24. A client reports a history of significant trauma that they believe directly contributes to their substance use. Which of the following therapeutic approaches is specifically designed to help clients process traumatic memories and reduce their emotional impact? A. Solution-focused brief therapy, SFBT. B. Eye movement desensitization and reprocessing, EMDR. C. Rational emotive behavior therapy, REBT. D. Existential therapy. Answer, B. Eye movement desensitization and reprocessing, EMDR. This question tests knowledge of specialized therapeutic approaches, particularly those effective for trauma. The keywords history of significant trauma, directly contributes to their substance use, and process traumatic memories and reduce their emotional impact are strong indicators for eye movement desensitization and reprocessing, EMDR. EMDR is a highly researched and effective therapy specifically designed to help individuals process distressing memories and reduce the negative emotional and physiological responses associated with trauma. While other therapies might address trauma generally, EMDR has a specific protocol for memory reprocessing. For example, a client with PTSD and substance use might find EMDR helps desensitize them to the flashbacks that trigger their cravings. When the focus is on directly processing and healing from traumatic memories, EMDR is a key intervention. Question 25. What is the primary ethical guideline regarding dual relationships between a counselor and a client? A. Dual relationships are always beneficial for building rapport. B. Dual relationships should be actively encouraged to foster deeper connections. C. Counselors should avoid dual relationships that could impair professional judgment or exploit the client. D. Dual relationships are permissible only if they involve family members. Answer, C. Counselors should avoid dual relationships that could impair professional judgment or exploit the client. This question directly addresses a crucial ethical principle concerning boundaries in the counseling relationship. The keywords primary ethical guideline and dual relationships focus on avoiding conflicts of interest and maintaining professional boundaries. A dual relationship occurs when a counselor has both a professional and another type of relationship, e.g., social, business, romanticy, with a client. Ethical guidelines strongly caution against dual relationships because they can compromise the counselor's objectivity, create power imbalances, and risk exploiting the client, ultimately harming the therapeutic process. For example, if a counselor also becomes a client's landlord, their professional judgment could be clouded. Always remember that maintaining clear professional boundaries and avoiding dual relationships is fundamental to protecting the client and the integrity of the counseling process.